Health, Psychology, and Human Nature with André Sturesson. Hey friends, hope you're having a great day. Are you following me on Instagram and Facebook? Please go to Health, Psychology, and Human Nature on Instagram or Facebook, or both for that matter, to get the latest episodes, inspiration, and more. Please take a pause and go there. Also, if you like the episode, please share it with a friend, family member, or somebody else who you think might like it. Welcome back, friends, to Health, Psychology, and Human Nature with me, André Sturesson, a science-focused podcast where we explore, learn, and improve our lives together. Can what we believe affect the outcome of a drug and change the neurochemistry of our brain? And what happens when we connect with and believe in our doctors? The placebo effect is a powerful real thing which can have a big impact in treatments and also in everyday life. And today, Karin, she will explain what the placebo effect is, the biology of the placebo effect, the mechanisms of the placebo effect, and a lot more. Karin Jensen, she's an associate professor and the leader of the Pain Neuroimaging Lab at Karolinska in Sweden, a research group focusing on the brain mechanisms involved in the experience of pain and the placebo effect. Friends, I really hope you enjoy today's episode. Karin, welcome to the show.
Thank you so much.
It's an honor having you on. I think it's I've watched some of the stuff you've done and some of the research you've done, and it's really fascinating stuff that you're working on. So it's a real honor having you on. So big thank you for coming on.
Mm-hmm.
Okay, so today we're going to talk about placebo, and I think that perhaps we should just start off by explaining what the placebo effect is. So what is the placebo effect and placebo?
Well, I usually talk about expectancy effects in general, and that's something that we all experience in our lives, that depending on what we expect, we might change the way we perceive a bottle of wine or the way we perceive our health. Placebo effects are the kind of expectancy effects that we see in the area of medicine. So it means that if we expect, for example, an improvement, if we take a medication, we might feel an improvement, and we might also objectively be able to show improvements just based on our expectations and not from any active ingredient of a treatment. So basically it's called inert. It means it has no active ingredient. So the placebo is an inert treatment that can still make us feel better because we expect to get better.
Right. So it's something about our expectations, not like an active ingredient in some drug that seems to handle the effect.
Exactly.
That's very interesting. Do you have any examples of, if perhaps for the listeners so it will become even more clear? Do you have any examples of the placebo effect?
Well, most of the time when we think of the placebo effect, it is in the realm of medical science, that we use placebos as a comparison to active drugs so that we can tell what component of that real drug is due to expectations and how much is due to the real active ingredient of the drug. So what we do is that we compare a sugar pill, for example, that looks like and tastes just like the real drug. We compare that to the real drug, and then we see what the difference might be. So usually when we think of placebos, it's something that we use in a test within medical science, but actually the placebo effect lies within all the treatments that we have. It's actually a part of everything that we take to improve our health. So I think that we should revise the way we think about placebos to move them from the realm of medical science into the everyday situation.
That's very interesting. So what you just said basically is that the placebo effect seems to be in most of our treatments for perhaps a wide array of different diagnoses. Is that correct? Or?
Yeah, that's correct. It's because usually we think of it as a black and white comparison between either real drug or placebo. So that either the active drug or the sugar pill. But in fact, when we compare the two, it's evident that they resemble each other quite a lot. So whatever happens in the group of people who take the placebo pill is actually also happening in the group of those who take the active pill, because the expectations are part of all the treatments that we take. So we can never separate them from one another. And that's, I think, something that people usually don't think about when they take their usual aspirin or so when they have a headache, that only a small part of the improvement can be attributed to the aspirin itself. And the rest of that improvement that we experience can be due to other things, such as previous learning and expectations and so on.
That is fascinating. So basically, like, let's say you're taking aspirin, for example. So if let's say that there's 100%, then perhaps 20% or 30 or 40 or 50% is the active ingredient, which actually reduces your headache or pain or whatever. And then the rest is other stuff, like perhaps what you have learned from before and what your expectations are and so forth.
Exactly. And that other stuff that you talk about, that
Yeah.
is the dark side of everything. That's the what I feel the most interesting part of this, because that other stuff is something that is present in all kinds of treatments. So not only if I study pain or if I study dementia, because that can be fairly specific what type of medications are being developed, but I study that other stuff, which means it goes across the board for all kinds of treatments that we see today. So that's why I feel it's so interesting, and that it can never basically be subtracted out of the picture. We can never remove it from the picture, because treatment is always given in a context when there are expectations around and there's previous knowledge and learning, and perhaps we have been reading up on a treatment. So any prior experience will feed into the outcome, basically, of the treatments that we take.
I think that's fascinating, because because it since it's something that is always there, then it's also very important to understand it, right? And to understand why, how can we help people to feel better? How can we perhaps use this effect to be able to help people better and increase their response to their treatment?
Yeah, I feel that it has been overlooked for many years. If we look back in history, it's not until the 1950s that people start taking the placebo effect seriously as something that should be studied with scientific methods and being included in medical science. But since then, we have been treating a lot of people with placebo as part of these clinical trials where we compare real drugs with placebos. So if we think about it, millions and millions of people have been on placebos.
Yeah.
So there should be a lot of knowledge that we can draw from that. Yet very little interest has been shown, and very few people have studied that group of a trial in studying those who had the placebo. So for me, as a placebo researcher, there is a gold mine out there in all the clinical trials.
Yeah.
So I look at it as the back side of a painting or something. It's always there, but very few people look at it.
That is so true. I mean, you can just go into almost any study or any like clinical trial, and there's always some part of it that is due to the placebo effect.
Yeah, the problem for me is that people are so intrigued by the drug development and development of other kinds of treatments that are not drugs. And so they sometimes forget about the placebo effect. So they forget to describe that, and they forget to provide the numbers for it.
Yeah.
Because all the focus is obviously on the innovation of new active treatments. So I mean, if I could say something to the medical community, is that please also make sure that you describe and provide the numbers for those who receive the placebo treatment, because there's so much to learn from that group too.
For sure. Is this when you send them an email and say, "Hey, why don't you focus more on the placebo?"
Well, sometimes one part of my research has been to try and make use of all the placebo treatments that have been provided in that kind of trial.
Yeah.
So it's called a meta-analysis, and we try to get hold of all that data and make a new analysis and say something about, for example, in my case, the question has been, are there placebo effects among men who take Viagra and similar drugs for their erectile
Interesting.
dysfunction?
Right.
And so if we want to answer that question, we could basically use data that's already out there from all those trials. But we had problems finding those numbers, even though the studies are very clear that half of the men were on placebo. And then you would send out emails. So to make a long story short, yes, I have been sending out emails to people asking them for the placebo data, because we know they were giving people placebos, yet they don't report them in their scientific papers.
Interesting. And that is also perhaps something that a lot of, just from my guessing here, this is something that it's not a lot of researchers who get the questions about the placebo. They probably get a lot more questions about the other stuff.
Absolutely. So they get so much more questions about the drug itself and the nitty-gritty details of the doses and the small differences in effects. But many people are completely overlooking that other half of the data set, which is the placebo.
Right. I think it would be very interesting also to perhaps look at a couple of different examples. I've seen in your presentation perhaps, or for example, that you've been talking about pain, and also seeing you've been talking about Parkinson's, for example. Perhaps you could talk a little bit about that, the placebo effect when it comes to pain and Parkinson's, and perhaps other examples that you think are good.
So I often get the question if there are certain disorders where the placebo effect is more prominent, and also if there are boundaries for what the placebo effect can do. So my answer there would usually be that the placebo effect cannot, the placebo effect is not effective in all kinds of disorders. And that's very important to understand, that the placebo effect cannot heal wounds or mend broken legs or treat cancer, for example.
Yeah.
But when we come to symptoms and disorders that are to a great extent overlapping with the central nervous system, or even that the symptom is under control of the central nervous system, then we know that there's a chance that the placebo effect can affect those symptoms. And pain, for example, is a very good example of a symptom that is under the control of the central nervous system. So there we can see placebo effects very clearly. We can also see placebo effects very clearly among patients with Parkinson's disease. And there, that's also a disorder of the central nervous system, so that the problems of patients with Parkinson's disease are coming from a deficiency to produce dopamine in the brain.
Yeah, yeah.
So that's why we think that the placebo effect can work there, because it's actually something happening in the organ of the body where expectations and learning also take place.
Okay, so basically, so it's the parts or the diagnoses that are linked to the brain, kind of, that are more prone to be affected by the placebo, and things that are not as linked to the brain, like our bones, for example, then the placebo effect isn't working in the same extent.
Exactly. And I think with now, that's of course a simplification of things, but the placebo effect can sometimes be exaggerated by people who think that it is a fantastic power that can heal the body the same way that a wound can heal or a broken bone can heal. But actually, we have most evidence for things that are under straight control of the central nervous system. So I would say yes, all disorders that have a lot of overlap with the processes of the brain, that's where we see placebo effects.
Interesting. And why is that?
Because it would be very difficult to see a mechanism otherwise, for how the placebo effect could improve a symptom or change our health. Because the way we think the placebo effect works is that in the brain, we have all the previous learning. We also create expectations about outcomes. And through those processes of the brain, there can be a what we call a modulation or a change of, for example, a pain or a change in anxiety or change in blood pressure or something. So we believe that there is something true that happens when there are placebo effects, and not only just a changed perception of one's health. And that's why the brain has to also have the tools or the system to change a symptom for a placebo effect to occur.
Right. I just think it's this is just fascinating. I think it's very interesting. Okay, but so there has so we learn, our brain learns, and we also have expectations of for perhaps a drug to work or not. But then, like, could you go deeper on that? Why is the learning and the expectations important?
Well, we know that the placebo effect can only happen if there is some kind of learning taking place, or some kind of expectation that drives the effect. And we can create expectations in many different ways. There can be anything from very simple types of learning, like associative learning, which is basically what Pavlov's dogs were doing, that we learn to associate taking a certain pill with a certain relief.
Yeah.
And if we do that many times, that will be an implicit type of learning, or a very basic type of learning where we don't need to be so consciously aware of the expectations anymore. And then we also have social learning. We don't have to be very aware of our expectations, but if we watch others, we might pick up on what they feel. So if we watch our friend getting some relief from taking a treatment, we might be prone to have that expectation ourselves and to feel better when we take the same pill.
Right.
And so that's a different type of learning. And then we also have like the most intellectual type of learning that we usually think about when we think of expectations. And that is somebody is telling us about the benefits of a treatment and what the treatment might do for us, or we might read about it online and learn about its mechanisms. And then we create expectations about the benefits of a treatment that can help us create placebo effects. But I think it's important, sorry, to see that there is a whole there is a whole repertoire of different ways to achieve expectations. It's not only by being told by a doctor, or not just by reading about the fantastic properties of a treatment. It happens in a very subtle way in social interaction between people, but also by just learning by doing and experiencing how a white pill can give us some relief from our headache, for example.
Right. That is so interesting. Okay, so there's a lot of different ways that our expectation can be changed, and so it's not just a doctor. It can be everything almost in life, or not, maybe not everything, but a lot of different stuff in life that can affect our expectations, and then also affect how different things affect us.
Yeah.
That's fascinating. Okay, but okay, so let's say that our expectations are changed by a doctor, or by us just taking like a random herb and we just feel really great. What happens then? Like, how does that change the actual? How does the actual effect then occur from that change in expectation?
You mean how? So now you're talking about the big gap between having an expectation, but from there, how can the body change its response and make us feel better?
Yeah, exactly. That's maybe that's the $1 million question, perhaps.
No. It's well, it is in a way, but we know much more. We know much more about that than we did in the 1950s, when people started being interested in the placebo effect and taking it seriously. When it comes to pain, we know a little bit about the mechanisms, and we believe that if we, for example, let's say, this is a very simple example now, if we for a long time have been taking a pill that reduces our pain, it could be, let's say it's morphine, and then we are suddenly, somebody is taking away the morphine and exchanging the morphine for a placebo pill, but we still believe that we are taking the morphine.
Right.
In that situation, we have had a very strong learning experience before that taking morphine leads to less pain.
Right.
And while our brains are holding that expectation, we then take this placebo pill. And when we take that pill, it's going to be a big surprise to the system that something else is happening. And instead of us just overruling that experience of something different happening to us when we take the placebo pill, the brain is rather going for what it has evidence for from prior experience. And so the brain would rather trust its experience and go for the fact that we are now getting pain relief. And in order to create that pain relief, the brain can then release the body's own morphine-like substance, which is called endogenous opioids, and create the same, or at least a similar, pain relief through the same pathways in the body as if we had taken the morphine. So in a sense, it is like a self-fulfilling prophecy that if we know something from before, we are not going to forget about that experience. We are rather going to try and mimic what we expect. And that means the body can, to some extent, mimic that by releasing its own morphine or some other compound, dopamine, whatever we are expecting, and create the same response.
I just have a million questions now. But okay, so that's really interesting. So what actually happens is that our body produces a similar compound that we would otherwise get from the drug.
Yes, and that might sound like science fiction, right? That if we expect to take a morphine pill, then our brain will release morphine-like molecules.
Yeah, yeah,
Or
it does.
if the brain expects that we are taking a dopamine pill, which is the case in patients with Parkinson's disease,
Yeah.
then the brain would start releasing more dopamine. I mean, it sounds too good to be true, but in fact, I think we are forgetting then that what we call we are forgetting something, because sometimes people think of this as the brain has access to the body's own pharmacy.
Yeah.
We have our own inner pharmacy that can release all these drugs that can make us feel the same way as if we were taking a real drug, right? But that's wrong in the sense that the drugs that we take, that we call the exogenous drugs that come from outside our bodies that we swallow in order to get an effect from them, they only work because those molecules are close enough to the receptors that we already have in our bodies that can naturally, every day, regulate all kinds of bodily functions. If that molecule that we are swallowing in our pill wouldn't look like what we already have in our body, it wouldn't work. So, in a sense, our own bodies is the original pharmacy, and then anything that goes on outside of us is only a way to try and um, kind of jack into what's already there.
Wow.
Did you
Okay.
get that? It's a little
Yeah,
bit,
yeah. No, but I think yeah, I understand. So it's we have our own systems and we use exogenous compounds and other stuff to affect the things that are already inside of us. But does that mean that like to how big of a degree does this work? I mean, because we have a lot of different substances, we have a lot of different things going on in our body. Like this I guess that science haven't come this far yet, perhaps. But like how many of the different compounds that we can create ourselves can we affect with the placebo effect?
Yeah, we don't have the answer yet, but during my career, I've seen more and more of what we think of as traditional drugs that the body can that we see that the placebo effect can produce itself, so to speak. So the last one in line, I think, was the endocannabinoids. It means
Right.
that the body's own cannabis receptors,
Yeah.
to put things in a simple way. So the reason that marijuana has an effect on our bodies at all is that we have a system in place that can react to marijuana. Oh, and then when we see that a placebo effect can release the body's own marijuana-like molecules, people are very surprised, say, wow, it's like we have marijuana-like molecules inside our bodies all the time. We just have to learn how to harness them, right?
Right.
But to me, that's no surprise, because otherwise marijuana would never work if there wasn't a system in place that looked similar enough for that to affect our system, So,
Yeah.
but that's the latest one in line, I would say, showing that when we experience pain relief from a placebo pill,
Yeah.
then we see that that can stimulate the body's own cannabis-like molecules.
So, because I think a lot of people have seen or heard about people who seem to be getting drunk by drinking non-alcoholic beverages. Is like does the body create the same things that alcohol otherwise creates when people seem drunk when they're drinking non-alcoholic beverages?
I don't know about the neurobiology of what happens when people think they're getting alcohol and then it turns out it's just a placebo. I know that I know from studies that it happens a lot, that when people think that they are getting alcohol, they are feeling subjectively, they are feeling drunk.
Yeah.
But what goes on behind the level of the subjective report in terms of the objective processes in the body. I don't know when it comes to alcohol. I know more about what happens in patients who feel pain or suffer from Parkinson's.
This is just so, I mean, because this is just so weird, you know? So let's say you're in a party and somebody is tricked to be drinking, not think that they're drinking alcohol, but they're not. Then, like, can the person take their car or not? You know, it's
I know.
it's an interesting thing to think about.
Yeah, and it comes to a very intriguing dilemma, I think, when we talk about placebo effects in sports.
Yeah.
Because there have been studies where the what is it called, the trainer, the person who is
the
coach,
or yeah, exactly, yeah.
When they have first given, so I'm going to give an example, that they have, for example, people who run really fast.
Yeah.
For them, pain can be a limiting condition. So if you give somebody who's an athlete morphine, they might be able to perform better.
Right.
So sometimes the trainers have been giving their athletes morphine, and they have indeed performed better. And then after a while, you stop giving them morphine. You pretend you give morphine, but you give them just placebo in the shot.
Right.
And they keep running faster. The question is, can we do that? Because in any doping check, or doping control, they would not be perceived as illegal, because it's just a placebo. But of course, the coach has then lied to the athlete.
Yeah.
The question is, where do we draw the line for what we consider doping? Can placebo still be considered doping?
Yeah.
Because if they strongly believe they're on morphine and they run faster, are they doped or not?
Exactly. I think if there's a coach listening right now, they're getting some ideas of how to get their athletes to perform better.
They know all the tricks already.
Oh, yeah, they do.
They're the best placebo researchers, I'm sure.
Oh, it's like the old school bodybuilders of biohacking.
Yeah, I think they are becoming the real experts on how to tweak things and how to also tweak the legislation around use of placebos. So I think that they are already doing it. It's just that the researchers are lagging behind in this case.
It's good that we have people like you then. Okay, but so interesting. So when these athletes are taken in for control to make sure that they're not using any illegal substances, then the placebo is not shown in their measures then.
Because what the placebo would be basically having a shot of water, of salty water.
Yeah.
And that would not show up in any screening. So it's only a matter of the ethics. So and then we come to the topic of the ethics. The question is, you can be clean on the from the pharmacological point of view.
Yeah.
And not doing anything that's illegal. But then, is it ethical to deceive your athlete if you are a coach or a trainer?
Exactly, it is more of an ethical issue. But I think it's also quite interesting now, because we recently just talked about that. It seems like when we are getting a painkiller, it seems like we're creating our own endogenous compounds. But now when we're talking about the placebo effect here, it seems like we might be creating different compounds inside of us, but they're not detectable, or it might be something else that is happening, perhaps in the brain, or something else that changes.
But if you give an athlete what they believe is morphine, but it's only water, and then you take a test, the test can only pick up on the exogenous compound. The test will never be able to see if you yourself regulated your pain from the release of endogenous opioids.
Right.
And I hope that somebody will stop me if this is completely a misunderstanding from my side, but all these all the molecules of the transmitters basically that I'm talking about, the endogenous opioids or the endogenous cannabinoids or so,
Yeah, yeah.
they are not looking the same as the exogenous ones, so they can be told apart. So all the endogenous processes are happening on an everyday basis. Every second, we have transmitters that regulate all our bodily functions.
Exactly.
So that goes on all the time. We already have them. It's just the balance of them in our body that can change depending. If we need to be more alert, then we will increase some. If we need to be more drowsy, there will be an increase of another one. So it's they're already there, playing their concertos all the time, and just different with different volumes from all the different instruments of the orchestra.
Exactly.
And then the brain is the conductor of that orchestra, trying to make all of the instruments play in harmony. But then sometimes we can increase or decrease some of these transmitters depending on what effect we want to achieve.
Interesting. But the interesting thing here, I think, also is that like this is going on all the time, and it seems to be kind of business as usual, or like the body really tries to all the time to just react to whatever we're doing, so that our body and our mind works as well for I guess it's different purposes, surviving, or I don't know, but
Mhm.
but the placebo effect seems to be something else. I think it's quite interesting still that we can have such a strong response from something that we can have such a strong response from our beliefs. Like, why do you think that we have this effect, that we can get such a strong effect from our beliefs?
Well, the boring answer is it's nothing special for the placebo effect. This is just the way that we humans survive.
Yeah.
We are completely dependent on expectations for our survival.
Yeah.
And that goes for everything. So all our perceptual functions, all our senses are based on these principles. So, for example, what we believe that we see with our eyes is basically a picture that our brain is largely where the brain is largely filling in the gaps for
Right.
us
Exactly. Yeah.
based on our expectations. And the same goes for the use of medicines and drugs, that we do get a specific effect from the drugs themselves,
Yeah.
but the expectations do fill in the gaps for us so that the responses will fit with what we have learned and what we expect.
Yeah.
And this is something and you were asking why, and the quick answer is we wouldn't survive for a long time if we didn't have this capacity. Is what if we would have to evaluate every single situation we
Yeah.
came into
Yeah.
like a goldfish in a bowl, and not remembering anything from what happened last time we were in a similar situation? It would take too long for us
For sure.
to determine what is a safe situation, what is unsafe. So it's become a winning strategy for us in terms of survival to listen to our expectations and to let the brain fill in the gaps for us so that we can take quick decisions based on heuristics, based on like rules of thumb,
Yeah. Yeah.
basically.
Yeah.
So these rules of thumb are helping us with survival, but they can sometimes also create these artifacts or these side effects that we sometimes believe that the placebo effect is.
Right. I was also thinking about, but I just need to ask a question before I get to the next point. But let's say, for example, if somebody is taking something that is really related to the brain, such as an antidepressant or a medication for anxiety, for example.
Mm-hmm.
If you would just generalize, what do you like? How big is the effect of the actual compound? How big is the effect of the placebo, and how big is the effect of perhaps just those two, the active compound and then like the our beliefs?
That's impossible to say because all drugs are different.
Yeah.
Um, Usually, across many different trials for many different patients and disorders, there is a similar response in the placebo group, like in the drug group. So they correlate highly.
Yeah.
So if there can be an improvement by the drug, because it's not always that the things that we try to treat are responsive at all to a drug. But if there can be a response of the drug, there can also be a response from placebo, because they correlate so highly. And it means we can't really say a number.
Right.
But I know that the drug companies are struggling a lot of the time to have the drugs approved. And that's because the placebo effect is close to the effect of the real drug in many cases. And that means for them to prove that their drug is performing better than placebo, they would have to show in many, many patients that there is a difference. Otherwise, that difference will not be considered significant.
Exactly.
So to me, it says something about that difference being fairly small, because the drug companies are struggling to show the differences. But then again, it's a huge difference depending on what disorder you're looking at.
I think that was very interesting what you just said there, because does that mean that in order for a drug to work, then our bodies have to be able to do the same or similar compound themselves?
Don't know.
Okay.
I don't know if I can say that.
No.
But usually, like, the reason I said that was, if you were to be very harsh and say, if we look at all the disorders of the world and all the drugs that have ever been used, how is the placebo effect there at all? How much placebo is there? And then it might look like the placebo effect isn't very impressive at all. But that's because there are many, many trials where the drug isn't very effective either.
Exactly.
Because you can't get a placebo effect if you're trying to treat cancer.
Exactly.
But a lot of the time, you don't treat cancer with a new real drug either.
Right.
But if we look into trials where we can actually, there can be an effect of the drug, there's usually some effect of the placebo too. That's how I understand the big meta-analysis that have been done across many disorders and patients.
Right. So it has to do something, but so it almost seems like for a drug to work, it has to beat our own system in a way, almost.
Well, but that's the old view.
That's the old view. Okay.
Yeah, because now it sounds like you think that it's either black or white. It's either real drug or placebo. But to a great extent, the real drug has the placebo response inside. It's built in. So it's not really beating our own system. It's about having a small part that, well, beating maybe, but they are to a great extent the same response.
Yeah.
The placebo response and the real drug response. It's just that additional piece coming from the real drug that needs to be there for the drug to be approved. But it, yeah.
Okay, so would you say that it is our own capacity to heal, and then we get, on top of that, we also get the effects from the drug? So those two combined, kind of.
Yeah, and now you're touching on a sensitive subject, because there are debates going on whether is this effect additive, which means is there a basis of the body's own response plus the drug response?
Yeah.
Or is it synergistic? Is there synergy? So maybe the body response will facilitate the drug response so that 1 + 1 is 3 and not just 1 + 1 is 2. So we don't know. It's a very complicated issue, this thing, if it's additive or synergistic.
I didn't understand that completely, if it's additive or synergistic. Could you elaborate on that?
In the additive, if the placebo effect is additive, it means if you're testing a drug, you will have the component of the placebo plus the drug on top of it.
Yeah.
So the two, in that case, it's like 1 + 1 is 2.
Right.
But then if you think of it in a synergistic way, it means maybe you need to have your body's own responses in place for the drug to be effective.
Right.
Maybe they're not just additive, maybe they are working in synergy so that if you have the body's response, you will have an even greater drug response, so that 1 + 1 = 3.
Right.
So we don't know yet if it goes for all disorders or if it's just in specific cases, but in some studies that we have done in this field, it seems to be additive. That the placebo group plus the drug group is just like boxes stacked on top of one another.
Right.
But in some cases, it's not that simple. It could be that you have an even greater response between the body processes and the drug. So it's not there. It's not possible to say a final a final thing about that yet.
Right. Interesting. Because one thought that I had when I listened to your presentations and when I looked into this was that perhaps this is something that we have always had as humans, that perhaps our old shamans or the old healing people of different cultures around the world that we haven't had these drugs per se, like antidepressants. We maybe have herbs and stuff, but we haven't had the kind of drugs that we have right now. And then perhaps with just belief that people have been able to help people with belief before, like 10,000 or 50,000 years ago. What do you think about that?
Well, I think it's true. And some experts on the placebo effect have said, they have said that the history of medicine is the history of the placebo effect.
Yeah.
If you want to be harsh.
Yeah.
Because before the beginning of modern medicine, as you said, there were all kinds of weird and bizarre treatments around.
Yeah.
And today we know that mummy powder would not be able to treat cancer, for example.
Yeah.
So we kind of know that any improvement that would come in those patients who took mummy powder for their cancer is likely due to the placebo effect. So we have a long history of treatments that are placebos, pretty much, that we can study. And so now what scholars think is that the authority of the shamans and the authority of the doctors in the old days, was likely the most powerful healing tool, and not any of those bizarre treatments or wonder drugs that they were using.
Right. And it's just, it just makes one think that, like, how much does the doctors of today and psychologists of today and other professionals, how big of the effect is, this just, the I have like the authority and the belief part from the patient, and how much is, our scientific medicine. It's yeah.
When I talk to the students at the medical program at my university, they sometimes become surprised that such a small part of what we believe is the most modern and evidence-based medicine can actually be attributed to the active ingredient, and how much of the response can be due to the context of the interaction with the doctor and expectation and things like that. And what I usually do when I talk to them is to say, Well, the reason why you need to learn about the placebo effect is not that I want people to start running placebo studies or so. That's irrelevant for you.
Yeah,
You are
yeah,
going to go out and see patients, but what you need to know is that the placebo effect accounts for a fairly large part of all the treatments that you are going to use on
yeah,
your patients. So if you neglect the fact that you inform the patients so that you can um, help the patients form expectations, and if you forget about the interaction and the warmth and the empathy and everything else that we know will foster positive outcomes, then it doesn't matter that you have the most modern medicines. You won't be able to achieve the maximum results, anyways.
right. Interesting. So it's kind of like it's kind of that we already have this part almost in our group, kind of, if we look at it from an evolutionary lens, and the doctors and the psychologists and everybody else is kind of taking that part, but in a contemporary version, in a way.
Yeah, some people like to see it that way and find it fascinating to think that the white coat of the modern doctor is not much different from what the shamans are using in other cultures. Because we have to also believe that now we are a little bit Western centric in the
Yeah,
way we're talking, because
yeah,
in
for
some other
sure.
cultures there are still alternative belief systems
Yeah,
in place for how human beings become ill and how they heal.
yeah, yeah,
We are also part of a belief system, which is our own, like medical belief system
yeah,
based in biomedicine. And sometimes we forget that we are also part of a very strong belief system where we believe in the white coats and the drugs and the hospitals and the professions. And that all play in also when patients are being treated, and it creates expectations and possibly also placebo effects.
for sure. Like you mentioned just before now, the different things that are important for a doctor when it comes to meeting the patients. And could you elaborate a little bit on that? Like, what is important to enhance the placebo effect when it comes to helping patients?
Well, I wish there was an answer. There have been at least studies showing that the interaction between the doctor and the patient or any other healthcare provider is important. The placebo effect will be dependent on a warm and empathetic relationship with the doctor. But then it varies a lot. It seems that some healthcare providers are very good at fostering that positive relationship, and some are not as good. So it depends what person you see, and it can also depend on what type of disorder you're having.
Right.
So we don't have the answers yet. I wish we could, because then we could teach medical students how to enhance that other stuff that
Yeah.
surrounds the active treatments that they give. But for the time being, we just know they have to pay attention because it's an important part of the treatment, but we don't have the manual to give them.
Okay. Okay. I heard something about, I think if it's just my interpretation, but something about basically having a chemistry between the two. Like it takes two to tango, kind of.
Yeah. Yeah, I've been doing some research on this because I was intrigued by how much of the placebo effect could be explained by how patients perceived the interaction with a healthcare provider.
Yeah.
And so I started studying the brains of doctors. So we put medical doctors in the brain scanner and we scanned their brain while they were giving a placebo treatment to a patient.
Right.
Um, and what we think from our research and from other people's studies is that there must be some kind of coherence between doctor and patient. There's no solution that's one-sided in this case. So we can't take a test. We can't let doctors take a test and see how empathetic they are or how positive they are or how much expectations they have. because it also requires that they will match with the patients that they see.
Right.
And then you may think, okay, but then it's just everything is noise and we can just mix any patient with any doctor. We will never be able to tell what the best doctor would be. It's useless information. But it's not, because it seems that some doctors have an ability to tune in to many patients. So they just
Okay.
have this capacity to find the wavelength of their patient and make the patient feel seen, and that the patient is having a positive encounter. So in some studies, we've had super doctors that have been able to create great placebo responses, while their colleagues have not been able to do the same things.
Interesting. So because that is something, yeah, exactly. So it might be something that has to do with the person, and might be something that might be hard to transfer to others then, or
It could be, yeah, and we just need to learn more about this. But for a while, it looked like, it takes two to tango. It's all
yeah,
about the coherence between two individuals, so it doesn't really matter. But then it turns out that, well, some doctors are just better at
yeah.
becoming the perfect tango partner for their
Okay.
patient, in a way. So
Yeah.
we are going a little bit back and forth with this. But
Right.
now we have started looking into the brain responses while patients and doctors are interacting, and that is helping us a lot, because at least I thought that we would have a hard time finding the same strong emotional responses in doctors when
Yeah.
they see patients, because they are in a professional situation. And before, we knew from romantic couples that when they have interactions in the scanner, they will activate very strongly if the other person is in pain, for
Yeah.
example.
Yeah. Yeah.
And then we thought that in a professional situation, we might not be able to get that same strong responses. But we found very strong responses between doctors and patients when doctors were in a professional situation. So
Interesting.
even though they are doctors and they are protected to some extent by that professional relationship, their emotional systems and their automatic responses of the brain are still being activated, just like anyone else. And that could also be helpful in protecting healthcare professionals from emotional burnout and other
Exactly,
things.
because that is also a big thing when it comes to healthcare professionals. There's a lot of
Yeah,
people who are really, really affected by stress and emotional pain. So,
yeah.
yeah, for sure. Wow, yeah, you're doing really important work. It's some fascinating and really important stuff, because this is something that really affects, I mean, healthcare providers, but also all the patients. It's a fascinating, important field. For sure. Okay, so we have to get off soon. But if somebody would
Mm.
like to to learn more about the stuff you do, or perhaps if you have some website or account or whatever, where can people find you?
The best way to find us is to go to I have a research group homepage,
Yeah.
and that is called kipain.com. And then we also have an Instagram account that updates you of what the lab is doing, and that is called KI Pain and Brain.
Perfect. Good name.
Yeah.
Okay, great. And if somebody would like to learn more about the placebo, do you have any recommendations of books that are good and easy to read, or web pages, or maybe a YouTube account or other Instagram accounts or whatever?
That's more difficult. There
Yeah,
are some books, but most of them are written for a medical
yeah.
audience. So, but if there's one name that I want you to remember, and if you just Google that name, you will find very interesting things. It's Ted Kapchuk.
Ted Kapchuk.
Yeah,
Great.
Ted Kapchuk, and it's KAP, etc., etc. So it's Kapchuk, and his research is very exciting because it ranges from anthropology and history, all the way to medical science and brain science and genetics too. So he's very wide in his approach to placebo effects. And I would dare to say that he's one of the most important people in the placebo field of all history.
Interesting. I think people really should check him out then and his stuff.
Yeah, it's just that his name is so difficult to Google because it's hard to spell. Ted Kapchuk placebo, then you will only get one guy.
Perfect. Okay, Karin, it's been a real honor talking to you, and I'm sure a lot of people learned a lot. And I mean, I would also like to thank you for the work that you've done. I've seen the presentations, and as I just previously alluded to, I mean, this is really important stuff, especially because it seems like the placebo effect really seems to play a big difference when it comes to helping people. So big thank you for the work that you've done and do, and thank you for coming on.
Thank you.
Hope you enjoyed the episode. Friends, I really need your help. I'm trying to get the podcast out there. So I was wondering if you could help me by leaving a positive rating and a review on your Apple device or the podcast player that you're using, as well as subscribing to the podcast. That really helps getting the show more visible on iTunes and other players. And if you don't know how it's done, then YouTube has a lot of great videos, so you can search there. All right, that's it. Take care. This podcast is for general informational purposes only and does not constitute the practice of medicine, including the giving of medical advice. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment.